It's Stroke Awareness Month, and recognizing the signs and what to do can be critical in saving lives. Here to help us and walk us through these issues is Dr. Ryan Shelton with Tryon Medical Partners. Dr. Shelton, hello, sir. How are you doing?
Doing well, Eugene. Good to see you again.
Dr. Shelton, let's start with this. What is a stroke?
So a stroke is a disruption in blood flow in the arteries in the brain that cuts off the oxygenated blood supply to the brain.
So we mentioned that it is Stroke Awareness Month. So how can we recognize if someone is having a stroke?
Yeah, so we want you to think about a quick way to remember what to look for. Think fast. So the word fast. F stands for face. Looking for, is there one side that's drooping? Is there some asymmetry or something going on with the face that's not normal? The A stands for arm. So thinking about, is there weakness? Usually would just be on one side. Can someone not lift, their arm on one side of the body? The S is for speech. Is the speech different? Is it slurred? Is it garbled? Are they not making sense? Making full sentences or making complete thoughts? And then T is for time, because time is of the essence. So if you are with someone and they have any of those things, or even just general confusion, the time to act is now. So you want to call 911.
We mentioned about time is of the essence. Is time of the essence because you mentioned it's a disruption in blood flow? So does that mean that blood doesn't get to your brain or to your heart, or what does that mean?
Yeah, so a part of the blood supply going to the brain is blocked for some reason, and usually it's because of a piece of clot that kind of floats and blocks off an artery, and that kills the tissue around that area. So the time is important, because if we can do a clot buster to get rid of the clot and open that blood flow again, then there's less tissue damage and thus less physical impairment. There's another type of stroke that's less common, is where a blood vessel can rupture, and then the leak of the blood causes pressure on the surrounding tissue and can damage the brain tissue. So the more likely type is the clot. So the time is important, because we can potentially get rid of that clot and or relieve pressure that can be in the brain to help treat the stroke quickly.
You mentioned already something that we can do. You said we can call 911. Is there anything else that we can do?
Well, and that's if somebody's having symptoms that you're concerned about and you think really could be a stroke. That is critical that we call 911 and get that in motion. In terms of prevention for stroke, all the basics are what matter. Knowing our numbers, what's your blood pressure, is it normal, not smoking, having normal cholesterol, not eating a lot of processed, really sugary foods that leads to high cholesterol and damage in the blood vessels that could contribute to stroke over time. So it's a lot of it's about the daily prevention in terms of hopefully preventing a stroke in the first place.
And Doc, you say the CDC is a good place to get more information. Is that correct?
Yeah, the CDC has great information on the different types of stroke and what to do. Also, the American Stroke Association. There's some great online sources as well.
Dr. Shelton, thank you very much, sir.